Hey, Cody, but you're getting pretty worried there.
No, I was just making sure I had the right link.
You did, we did not.
It's okay.
Saved by the bell. We got 2 minutes going on here.
Yeah. Fair warning to you, I am battling allergies like crazy today.
Oh, me too.
So if I start sneezing, that's why. Even just
Oh, I'm
thinking,
sorry. Mine's more like back of the throat stuff. So, yeah.
yeah,
All right. So the way to work here, Cody, is I'll do a little introduction, very little, and we'll just turn over to you. You can share. Can you make sure you can share your screen right now? Do you see that
yeah.
as an option?
It says host disabled participant screen sharing.
We'll just make you, can you make him a co-host, Kim?
Yep, I'm on it.
And you
Also,
guys probably haven't met. Cody, Kim, Cody.
Hi, Cody. Nice
nice
to
to meet
meet
you.
you.
Thanks for
Can
having me.
you bet, can you check now and make sure you're good?
Let's see here. Yep, I can do it.
Perfect.
Awesome. Okay. And Cody, once you start talking, we'll pin you probably to the room.
That works for me.
Yep.
And I have prepared for probably about 30 minutes.
Perfect.
And then I can do questions if that works.
Yeah.
Okay.
Is there something, do you have one that you could like that you want to make sure gets asked, and then I'll make sure I pitch that if nobody else does?
Hmm. I don't think so.
Okay.
Um, but I'll let you know if that changes. I thought if we had
Okay.
extra time, that maybe I could actually open the map that I showed you
Yeah.
guys to show like some examples and like maybe ask
Yeah,
folks
that'd
if
be
they could
awesome.
like tell me your city and I'll look real quick.
Yeah, that'd be awesome.
Okay,
It's a
All
great
great.
right,
way
I'm
to do
gonna
it.
let everybody in because it's
Alrighty.
noon.
Good afternoon, everybody. Thanks for joining us for this edition of our third Thursday's Lunch and Learns. We're happy to have you here. We're going to wait just a minute or two while we get more people in from the waiting room. It's great to see so many people here. It's nice that we keep, for those of you who are regular attendees, you'll notice, I'm sure, that our numbers keep getting bigger and bigger every month. So that's great to see. Kim, just let me know when we're about that ready.
All right, we're slowing down. We could probably get started.
Okay. Okay, great. Well, again, hello everybody. Welcome to the IPHA Third Thursday Lunch and Learn series. This whole series is organized by our education committee, which is a group that any member of IPHA is welcome to join and help out and help us curate some of these great sessions that you've all been enjoying. Really, the point of this hour, there's no homework, there is no pre-reading. You're here just to listen and learn while you eat your lunch on or off camera. Hopefully you'll take away some nuggets that you can follow up on. Feel free to ask questions, put questions in the chat. We'll pitch them to Cody at the end. It's going to be a great presentation. Cody and I met yesterday, and I was wowed by what he had to share. So, speaking of Cody, Cody Smith is our partner with Iowa Environmental Council. And we've been partnering on a grant about climate change and climate justice and the intersections with public health. And he and his team have been doing some amazing work and have created a multi-layer map that I smile and nod and pretend to understand. But it's really fascinating. So we're going to hear from Cody today. He's going to go through that grant, the map, a lot of other work that they're doing at Iowa Environmental Council, and it's with some suggestions on how you can get involved in climate justice as well. So Cody, with that, I'll turn over to you.
Well, thank you, Lena, and thanks everyone for being here. Hopefully after this presentation, Lena, the map will make more sense to you and everyone else on the call. I'll get into that here in a minute, but as Lena said, my name is Cody Smith. I serve as the Director of Climate Initiatives at the Iowa Environmental Council. I've prepared some slides for today, so we're going to see if I'm able to do that. Let's find out together. It looks like I was able to. Okay, great. So I'm going to make you guys big over here too, so I'm not just staring into the void as I present. So let me get that situated. Okay, perfect. Well, as Lena said, today I was hoping to talk about the intersection between climate change and public health. We have been working increasingly with public health professionals on the intersection between the impacts of climate change and also the impact of those on human health and community health and infrastructure. That's really where the program that I lead sits at the intersection of. But I'll start by just telling you a little bit about the Iowa Environmental Council. We are a statewide nonprofit organization. We are nonpartisan, and we are Iowa's oldest and largest environmental coalition. This year, we celebrate 30 years of being an organization. We're a small but mighty team, smallish. We have 14 people on staff. We're based here in Des Moines, but we have some staff up in Sioux City and Iowa City, and we work to make sure that we are serving every community across the state. Some of the values I think are important to mention in this conversation today. Our work is largely informed by data, science, and stories. We try to lift up the voices of Iowans that are most impacted by environmental degradation, climate change, other issues we'll talk about. And sometimes it's our role to educate on these issues and lead, but most often we learn from Iowans across the state and we follow their lead and support their community-led and driven solutions. We are, again, inclusive and nonpartisan, and we do take pride in listening to others as we develop our priorities and guide our work. Overall, our mission is to build a healthy, just, and sustainable environment for all generations of Iowans to come. That's a hardy task, but I think those of you in this Lunch and Learn today can relate to having a lofty goal, but some dedicated staff behind it. Also, you are dealing with me today as I'm assuming is an allergy attack from all the tree pollen. So please deal with me if I'm sniffling or if I have a sneeze or two in the middle of this. A little bit about me. I'm the Director of Climate Initiatives, as I said. My background is in the intersection between energy, water, agricultural systems, and climate. So thinking about the built environment, which is a familiar term, I think, for each of you in public health, whether that's water, wastewater, drinking water, clean energy, energy grid, all of those systems that power our daily lives and our communities. How are they impacted and how do they interact with climate change? And where are the sources of pollution that they cause across the state? And how can we help communities adapt to that? So as part of that, I mentioned in the beginning, some of the work that we do is about education. So informing Iowans about what is impacting their community health and their individual health as a result of the way that the community is built. So today I'm going to be kind of overviewing a little bit of the climate change and environmental health map, which is a map that we created through a grant that we actually have IPHA and Lena as a partner to help understand more about, what's going to happen in Iowa over the next 30 or so years related to climate change and what exists now with pollution. So let's get into that. We often orient our work in the climate change and environmental pollution space around what we refer to as disadvantaged communities. So I wanted to take a second to define what those are and let you know what the process has looked like for us to define them in our own words. So I'm going to start on the right side over here with the environmental justice, climate, and pollution indicators. These are the things that are present in communities, whether it's pollution or climate change risk or other indicators that I like to say as the EJ ones. They add context to how people can either respond to these challenges or how they have been impacted by them. So some examples from that include ground level ozone. That's more of a pollution indicator. The flood risk is something we expect to happen more with climate change. Same with the loss of agricultural products due to natural disaster. Particulate matter in the air, I'm sure you all are very familiar with that. And then energy burden is the cost of energy as a share of your annual income. And then we combine that with economic indicators like poverty, unemployment, annual median income, et cetera. And then we also added in demographic information that we see as key to understanding these challenges in Iowa. So a lot of these listed here, most of these, I guess all of these are racial indicators, and kind of just thinking about what percent of the community is Black or African American, what percent of the community is Native and Indigenous, and how does that play into these other systems to define disadvantaged communities? I don't love the terminology. You may have heard this referred to as frontline communities or EJ communities. I just want to clarify here that this terminology does not mean that these are not vibrant, thriving places to live. They just face outsized challenges as a result of these three buckets of factors. So looking through what we put on this map, which we'll get more into, we started with pollution indicators. So thinking about sources of environmental pollution, and some of those are listed here, but I'll list a few of them. Industrial air pollution, think smokestacks and industrial processes that have emissions that go out into the community, and they have to deal with that. Wastewater discharges, thinking about, let's use a coal plant as an example. They use water to cool and run other processes in their facilities and then discharge that out. Where's that higher in the state is what we were looking at. Emissions and pollution from transportation. I live here in Des Moines, not too far from Interstate 235. So you can imagine that downtown traffic corridor has higher levels of air pollution from nitrogen oxides and sulfur dioxides from car exhausts and diesel trucks and those sorts of things. So there are some examples here related to air, some related to water, and there are some that are related to land. You see toxic waste sites and Superfund sites, and then even leaky underground storage tanks. We know that these things impact human health in a negative way. And what does that translate into? Well, that's where you all come in. The negative health outcomes that residents of our communities face, whether it's asthma, COPD, heart disease, those groups of people are more sensitive to this type of pollution. So here's one example. This is more of an overview of the connection between pollution and health. This is what the EPA calls percentile for toxic releases to air. They use it as a proxy to look at in the air what pollution is there that is known to cause respiratory cancers, like lung cancer or other respiratory disease, asthma, COPD, as I mentioned, or make those conditions harder to live with. This map is our first one that we'll see that's a screen grab. I'll just point out that the colors on the map allow us to see where the hotspots are in the state of Iowa. And you can see this call out to the Des Moines region, but it's a very prevalent issue across the state. Those numbers, however, that are in the bottom right on that legend, those are federal numbers. So it puts all of the census tracts in the United States on a level playing field, lays them all out, and then ranks them on this factor. And when we do that for this respiratory cancer risk, we see that Iowa has communities at and well above the 80th to 100% percentile nationally, meaning that they're 80 to 100% higher than the rest of the country for this risk. So that's just one example of the pollution indicators. When it comes to climate change, we know that the most common expected impacts of climate change that will be devastating in many ways to our communities include frequent extreme weather, like storms and tornadoes, but also extreme heat. That's a partnership that we're working to, an issue that we're working to discover and explore and remediate in partnership with public health professionals across the state. Just last year, we had one of our state's earliest, longest, and most intense heat waves ever, and that was in May. Normally, we reserve those types of weeks with 100-degree days, heat index of 115, and then overnight it doesn't get below 80 degrees until August, and it's usually pretty rare. Well, that's happening more and more and more, and we expect that to continue. And of course, flooding is a huge risk for the state of Iowa as well. So in that bucket, Here is the flood risk. This is a FEMA, Federal Emergency Management Agency number that ranks communities, again, by percentile about their flood risk, the share of properties at risk of flooding over the next 30 years. You can see that this is a statewide challenge. It's not a surprise to many of us. But what I will note in this Des Moines call out here, you see these very dark blue areas. Similarly in Cedar Rapids, Iowa City, Davenport, and some of these rural areas you see throughout the map, those neighborhoods are often at or above the 90th percentile nationally, meaning, as we know, that Iowa has a very outsized risk of flooding over the next 30 years as a result of climate change. So what we do when we think about pollution and climate change is we try to tie it into environmental health, basically recognizing that it's difficult to directly attribute these factors to health conditions and chronic disease, including asthma, COPD, diabetes, other things. But regardless of causation, a lot of the factors we'll cover on this map do make these conditions harder to live with. And so we try to recognize that in our work with community leaders like emergency managers, public health officials, cities and counties, as they design adaptation solutions or pollution reduction activities. Thinking about these vulnerable groups is really important. One example that we talk about a lot is asthma and air pollution. So I'm going to show you just a quick video. There's no sound here. It's only 9 seconds, but what it'll show you is what one of the functionalities of the map I'll show you more of includes here in the state of Iowa. So this is Davenport. I'll point out that on the right side here is our asthma rate. These census tracts right here, and you can see how small these might be in a metro area. They are at or around the 80th to 85th percentile nationally for the amount of residents that live there with asthma. Now, it's a little harder to tell because the way we have it grouped here, but the same census tract on the left side here is the air pollution, particulate matter in the air. So those are, fine particulates that come up from concrete manufacturing or coal plants, or, you name it. There's so many different sources of this type of pollution, but it's notable that from this bottom left corner all the way up to the top right here, the top 10 highest and most polluted by PM 2.5 census tracts in the state of Iowa are all right here. At the same time, these folks here have an outsized rate of asthma. So this mapping tool allows us to see that correlation. These are the top 10 for PM 2.5, and you can see the underlying asthma data there as well. So that's just one example of how we can use this map to help inform our public programming. Let's see if I can get this to move forward. There's another category here that I think is really important to recognize, and we refer to that as environmental justice. You've probably heard at least of this. Essentially, it's a recognition that a lot of socioeconomic groups in our state and nationally are just more vulnerable to the impacts of pollution, climate change, and they face other barriers in their lives, whether it's language barriers, economic hardship, racism, systemic discrimination, that make it harder to respond to these challenges of pollution or prepare for flooding from climate change. So recognizing that everybody's starting from a different place. And that there's several communities across the state of Iowa where these are real challenges. So some of those indicators allow us to see this. This one is the housing burden in the state of Iowa. You would see a lot of what you expect here. Our university towns kind of rise to the top. But then also, as you zoom in on some of our metro areas in particular, you see that Des Moines, it's the same in Cedar Rapids, and in Sioux City. There are a lot of areas where people are paying a significant share of their income on housing every month. You're not considered housing burdened until you spend more than 30% of your annual income on your housing costs. And that kicks in at this 50th percentile. You can really see across the state, there are a lot of folks with a low income that are paying over 30% of their income for housing, especially here in this call out in Des Moines. And I described this earlier, but I'll reiterate. I think these other environmental justice indicators, they provide context to where people are at, what they're already dealing with, and how they're able to respond to new challenges. So all of this was a start to kind of inform us so we can inform local officials and individuals like yourselves, public health professionals especially, about the impending or existing health impacts that can come from pollution and or climate fueled extreme weather. So when we think about IEC's role here, it's not to do disaster recovery. Like I said, we have a team of 14. We're all policy nerds or lawyers or former engineers or just not the group of emergency management personnel you would really want to show up, or Red Cross volunteers that have been trained in this area. Our role really helps us, analyzing our role helps us figure out how to be most effective. So on this kind of scale that you see here, our sweet spots are on preparation, planning ahead of storms, ahead of extreme weather, and helping make our communities more resilient to that. And then in the long term, adapting those plans, that infrastructure, our communities, by connecting them with technical and financial assistance, and other resources they might need to do the resilience planning that would make a community a better place to live. This map is a part of that, identifying those hazards, sharing this information directly with local officials, and as I'll talk more about here in a minute, hands-on engagement with how do we consider these more fully in our processes. So the project that we have with the Iowa Public Health Association also includes the Iowa Council of Foundations, which is a statewide group that represents community foundations in our cities and communities across the state and in rural areas. Those foundations play an integral role in emergency management and disaster resilience. They help facilitate communication. One example I can think of is in the Quad Cities area. That community foundation is a central partner for getting resources out during a disaster. And you may remember the apartment collapse that happened there in Davenport a few years ago, where an entire building collapsed and injured and I believe killed at least a few people. It was a heartbreaking incident, but they led on that response with the emergency management folks. So now they're looking at the future and trying to think about, okay, what different factors played into that? How do we prepare for the future more effectively? So that's just one example of the role that a community foundation would play. And you all as public health professionals know what your work is on monitoring, on planning, on mitigation. We've all seen the value of public health over the last 5 years in particular. A couple of things have happened in this space. And we also work directly with local governments. So this project is through the CDC Foundation, and it sits right at that intersection between public health, emergency management, and climate change. How do we prepare people to respond? Well, one of the exciting extensions of that project that I'm working with our partners right now on is to develop tabletop exercises for local officials and stakeholders, including public health, emergency management, and other sectors, to facilitate conversations on how we prepare for these floods, these derechos, these tornadoes that are going to be happening more often, but also ones that are more silent killers. And as you know, in public health, extreme heat is, I believe, the leading cause of death by natural disasters in the United States every year. And it's not something that we do a lot of planning for. So thinking about how we respond here is a key part of our project. I'm also excited that we are working with a National Institute of Hazard Mitigation Research to host a fellow as part of this project, where we're going to have their assistance as a PhD fellow in assisting to develop these tabletop exercises and deliver them to communities in person. Hopefully this will serve as a model for us to expand beyond the 3 communities we have identified. So what I thought might be helpful here, if you're interested, I'm wondering if I can show you all just a little bit more of our map. And as I'm talking, if you are interested in seeing what things look like in your community, if you have an issue you want to talk about, if whether it's a pollution indicator like air pollution, water, energy burden, as I mentioned, or if it's a community that you want to look at, let me know and I'm happy to walk through it. But I'm going to show you one example here. So here's our landing page. You can find it by going to our website, iaenvironment.org, go to Climate Initiatives and Community Resiliency. And then there's this link here for the Climate Change and Environmental Health in Iowa map. That takes you to this page. I know I built this map, so I know how to use it. So I'm not going to go through the code book and user guide, but if you're using it for the first time, it will help you. It makes it easier. One of the most valuable things I've seen so far from this map in the 2 months we've had it out is people are using this and this information to write grant applications. So that might be a helpful use for you all as well. So let's dive in. I'll be the first to admit it takes a second to load. There will be some, you'll have to wait a little bit each time. That's because there's so much info on here, as you can see it loading in. And it just takes a second for the system to catch up. But there's some tips in that user guide to help you be able to make it move faster. So here is the map itself. The first thing I'm going to do, and again, and this is in the user guide, is go here on the layers, and I'm going to turn them all off so it loads faster. And then I'm going to look at what I think is most interesting to me at this point. What do I want to look at? Well, let's look at particulate matter pollution in Iowa. We see that it's a lot worse on the eastern side of the state. There are some exceptions, though, in some of our communities across the state. Sorry, I'm just searching through. I'm trying to do this by memory. There, for example, in the Omaha Council Bluffs area, that didn't really show up until we zoomed in. So if I wanted to look at this and see what is that, it's at the 51st percentile nationally. It's always going to be the first number is what you have clicked on here. It's not that high nationally, but this is a hot spot in Iowa. So that's one example. These are other types of particulate matter from transportation, diesel particulate matter, 68th percentile, for example, pretty high nationally. There are some areas that have high ozone. Ground level ozone can have a number of health impacts, especially for those with sensitivities like asthma. And in addition, ground level ozone does contribute to the loss of crop productivity and other things. So Sioux City has the most coal plants of any community in the state, a huge contributor to ground level ozone that can combine with other contaminants to create hazardous air pollutants and causing more health issues. So 60th percentile, those sorts of things. So I'm going to show you one example of what I think this can be used for. And let's go to Waterloo. So I wanted to show a couple of things. So this is all defined. All the definitions and sources are in that code book you saw linked on the other page. But one of the things that we have on here is racial information. So this is percent Black or African American. And let's also do historic. We have some of our, essentially what we've classified them as is environmental justice. So there is somewhere in here, this one here, historically redlined communities. I have both of those layers on, and you can kind of see how they overlap, but you can't really see through them until you use this swipe tool. So then what I'm going to do is I'm going to zoom in, and I'm going to use this tool to see what the overlay is. Okay, this is interesting over here. It's not a high existing population of Black or African American, but it is historically redlined. Whereas these two census tracts right here contain the highest number of African American residents in the state of Iowa, 81% in this community. And then I believe, let me just turn that other one off real quick. I believe it's 60 in the other one, but you can see some of these relationships, 42% in the other one. So now let's say, okay, those were historically redlined neighborhoods. Let's keep that one on. And let's look at existing risks from climate change. How about we go with flooding? So again, can't really see through them until you hit this tool. So we can see we have a very high flood risk down here in Waterloo, in this downtown area, 83rd percentile nationally. And then you can kind of click through and see these other ones, 78, et cetera, 99th percentile, which is obviously pretty low. But you can see the overlap between historically redlined communities and flooding. It's almost 1-for-1 in this area. But these types of connections allow us to help prepare more effectively for these challenges and also decipher who is most at risk from what different indicators we do have. Now, I'll just show you that one last example of the asthma and particulate matter pollution here in Waterloo as well, since we're already there. So this is PM 2.5, not as bad as over in Davenport, pretty standard. But if I go to this respiratory cancer risk that we talked about, I wonder what that looks like. And we can see some of that overlap in the metro areas, and it's not always perfect. But if I click on it, I can see that it's in the 94th percentile nationally for people with asthma. And I can also look at the 74th percentile over here for toxic releases to air, that respiratory cancer risk. You can also add in your business name if that comes up. Let's see. Well, that took me over. Never mind. Environmental Council. Let's add Des Moines. Here we go. Well, that's not the right one either. But despite that not working very well, what I mean is if you put in your address, 505 East 5th Avenue, Iowa, that's our address. So you can kind of see, it takes you right to it. You can analyze, you can take the layers off and even look at the underlying imagery. You can, let's say you want to see near your area, is there a Superfund site, for example? There are several over here in Des Moines. So one example, okay, I want to see how far this Superfund site or this census tract with a Superfund site is from this park. And let's say it's over here, it's a mile. Those types of things can be helpful for you in planning. You can also say, how big of an area is this over here? If I look at these different things, okay, I can make a square, double click at the end, and it tells me how big. So these different tools can help us plan. You can also share this map using a specific link that takes them to the exact area that you're zoomed in with those tools put on there. So there are many ways to use it. I invite you to play around with it if it's something you find useful for analyzing these risks in your community. And at this point, I'll go back over to the slideshow here. If I can get it to pull up. Well, let's try that again. And I will just pause here and see if anybody else has questions while this loads. But really, that was the last thing I wanted to show, and just thank you for being here today and thank you for your time. And at this point, I'm happy to answer any questions that you might have or explore other communities that you might want to look at. So I'll pause there, Lena.
Thanks, Cody. Really great information, and I know that I could totally geek out on that map. So we do have a couple of questions in the chat. The first one is, could you explain a little bit more about Superfund site? I think a lot of us know that term, but what does it really mean in terms of health? And then the second question, also from Arlene, is about the river around Davenport and air. Does that increase air pollution? So maybe we could go back to the map for that one.
Right. Well, thank you for the questions. Superfund sites are contaminated sites with toxic chemicals of some sort that have been either identified as carcinogens or just generally harmful for human health. The EPA has a national priorities list that technically makes a site a Superfund site, meaning it's on the list. The program that started it was called the Superfund program. And that means that these are severely contaminated sites that need to be remediated or cleaned up before they can be used, for other purposes in the community. There are some examples, there are many examples across the country of communities getting access to funding to remediate their Superfund sites and then turning it into a community asset. One of the examples of that are, well, there are several examples of parks and things here in Des Moines that have been cleaned up and used for other instances. And the indicators that you saw on the map, there are two indicators here for Superfunds, Superfund sites. The first is proximity to them as a national percentile. So again, just kind of comparing how close this area is to those sites. And the second one actually has a count of each of the census tracts and how many Superfund sites they have. So you can see that in your community to see if there is one. So that was the value sort of combining these two federal data sets with one another. And then on the question on Davenport and air quality with the river, I don't think that the river itself would have anything to do with the air quality there. It would be normally my personal I guess speculation, having spent some time in that area, is that there are a lot of concrete and gravel plants and some other like ethanol industrial facilities, and just a whole industry corridor there that I think contribute to that. If you drive through there, and many of you may live there, I'm not sure, but there's just sort of a cloud that was there. The other thing I will say on that is that these industries were probably purposely located there because of the river and the water resources they need to function. So not necessarily causing it, but definitely potentially playing a role in having led to the circumstances in the first place.
So you mentioned the Superfund, and that was started with EPA and such. Given the political situation that we're in now, are you worried about Superfunds the list being dropped and like we no longer have Superfund sites, or like I imagine that's the worst case scenario, is that we just ignore them, or kind of what's the outlook?
Yeah. Well, I think it's really important to look at both the funding aspects of it and then also the staff. So the first thing I would say is the funding for almost everything. I mean, we all dealt with the federal funding freeze, and EPA grantees like us have lost millions of dollars over the last couple of months. The brownfield sites and the Superfund funding was frozen as well, because a lot of that came from, or at least got more funding from, the Inflation Reduction Act and the Infrastructure Investment and Jobs Act under the last administration. So that definitely has happened, that these have been deprioritized or frozen. I will say, however, that it's probably one of the areas of the EPA's mission that has the most bipartisan support. And even the current EPA administrator just visited a Superfund site cleanup project just last week. So I'm hopeful that that means that at least these will be exempted. But the other part I wanted to mention is if they move forward with their plan to eliminate 60% of the federal EPA staff, there's almost no way to continue at the same level for any EPA program. And we've seen that already in our own experience with the projects that we had before.
Great. Well, I invite anyone else to continue putting questions in the chat, or unmute yourself and ask questions to Cody directly. And he's offered to look up particular areas around the state, maybe where you live, or what you have questions about. And he has put the link to the map in the chat.
So I see a comment here from Mary about Dubuque doing a study on their relationship with air quality. It had to do with colder temps and wind inversions. That's really interesting. Those are the types of local things that it's really hard for me to learn about unless I know folks in the area doing the work. So I guess I'll just show what I see on our map when it comes to air quality and Dubuque. So this is just PM 2.5. It's in the 60th percentile, kind of all up in this area. Let me turn off this other layer. Here we go. So this is kind of what we see: 60th percentile, 61st, kind of average all around there. It doesn't vary too much on a small level because it's the air, but that's interesting to know. One thing I will point out about Dubuque that maybe you weren't aware of is something that really sticks out to me. So this is the energy burden. I mentioned this earlier. This is the share of your income annually that you spend on your utility bills. This does include gasoline for cars too. So it's energy services. Once you get over 6%, you're considered to be disadvantaged. And so when we see what we see when we look in Dubuque, 85th percentile nationally, 92nd percentile nationally, 96th percentile nationally. So what this means is that, especially this area here, and I'll just turn on the swipe tool so we can kind of see where it is. So for those of you that live there, you can see it's kind of this strip. And I know from being up there, it's older homes, it's lower income areas, it often is more diverse. And so this is something that I use in my communications with policymakers about the cost of energy in Iowa. So the other part of my role is I go up to the Capitol, similar to Lena, and just sort of talk through these issues and provide information about why fair and transparent utility planning matters. Because though we have lower electricity rates than other states as a whole, this community in Dubuque can't really deal with a lot more than what they're dealing with now, knowing that they're paying just about as much as somebody in New Jersey as they are here in Iowa. And we know that the incomes are much different between the two states. So I just wanted to point that out. Mary, I see you're off mute. Definitely jump in here.
Well, first of all, that last point you told us is totally cool. I don't think our GIS person has that, so I'm going to definitely share your maps with her. But getting back to the air quality study, it was probably back in, I don't know, 2015, maybe earlier. We were on the verge of being non-compliant for PM 2.5. So we did commission or had you and I think it was you and I helped with a study, and I could send it to you. But that's, not being a weather or air professional. The basic gist was it did have to do with these inversions with cold weather stuff. Since then, we've done a lot of things to improve our air quality locally, especially with traffic management and roundabouts and all those kinds of things. So that's probably why it doesn't look too bad now, because it has improved. And I will say our closest air quality monitor, which they base everything off of, is in Potosi, Wisconsin, which is just northeast of Dubuque, about, I don't know, 10 miles, something like that.
Right. Well, I'd love to see the study, so definitely feel free to send that over to me.
Sure.
I think it's really interesting how the geography, the industry, the people in a community really determine what some of these things show. And we talk about the energy burden issue that I just talked about. I want to show one other thing with that, and I think it has a lot to do with one another. So I showed this to Lena yesterday. This is what they use as a lead paint indicator, but it's a proxy for that, but it's really homes built before 1960.
Right.
And we know that Iowa has a pretty old home stock, but let's look at that same exact area right here, 91st percentile. We know that older homes are less efficient. They have poor insulation, but what may surprise folks as I zoom out is how bad it is everywhere in the state, essentially. But there's one phenomenon that's really it's illustrated here that I think is one of the key things I've taken away from this project, is that we see all of the older homes in the urban centers, right? Like here in Des Moines, and we see them in the rural areas. And then we have these rings of the suburbs that we know have been growing: Ankeny, Waukee, West Des Moines, Norwalk. These are the areas with new homes. They also have less pollution. They have a higher income. And so we kind of see like this economic segregation between downtown centers, with obvious exceptions, and then rural areas, but then this middle kind of ringed community of the suburbs, kind of here in Des Moines especially. But we also see it up in Cedar Rapids. Dubuque was a unique one where it was kind of all in this downtown area, but then I know that this is kind of a sprawling area of Dubuque with single family homes. So it's something, it tells a story that I've seen over and over again with these maps as I've done this project. So I just wanted to take the chance to share that.
Thanks, Corey. Could you maybe talk a little bit more about the tabletop exercises that are being developed and how public health departments might take advantage of that?
Sure, I'd be happy to. Thank you. So we are going to be working directly with, hopefully getting some feedback from you all at some point too, through Lena, but also with the community foundations to figure out what their needs are first. Meeting with the folks in Quad City with that apartment example I gave in the Quad Cities. That example, they said, we don't know how to communicate effectively and quickly as well as we should with our emergency management folks. So communication based on different emergencies is one thing that I already know is an issue. And I think you all would probably agree with that. I also do know that interagency communication, such as between the county public health department and emergency management, may not always be ideal. So that might be a focus there. The other part of it is communicating these risks in a way that's relevant. It's not, here's our map, go look at it. It's, I'm in Davenport, what did I see on this? This is the best available federal data on each of these challenges that we've looked at. Some of it may be from 2021, some of it may be from 2024, who knows? Well, it's all listed in the spreadsheet that we have, but I won't bore you with those details. My point being that what we can do is we can take this data, which is the best available data, and make it useful for the folks in the community. So with the fellow that I mentioned, my hope is that similar to traditional emergency management exercises, we can take that model that people are familiar with and take it and expand it to include more stakeholders. Public health being one, emergency management, of course, and then community foundations. And we are going to be doing this in 3 communities, hands-on. I will personally be there talking this through with them and kind of verifying the data with them and what they see in their everyday work. So once that's done, we'll walk them through the tabletop exercises and we'll see what additional needs they've identified. And we hope to stay engaged afterwards to say, okay, is it a communication error? Should there be better governance in this area? Does the Hazard Mitigation Planning Committee for the county not include the right voices? Are there other ways to solicit public engagement and feedback from the most impacted populations, like, for example, those with heart disease, and we have a heat wave coming through? We know that those folks are more vulnerable, but maybe their concerns have not been considered at all. So it's really about taking the data that we have, sharing it with them, seeing if it aligns with their planning processes, identifying gaps, and then connecting them with the communities that are most impacted and the organizations that serve them, because that is a need that we need to pay attention to. And to that end, I want to show you one more thing that is probably the most morbid on the map. This is what they refer to as the expected population loss rate. So maybe you think numbers of people, that sort of thing. It's actually injuries and mortalities from natural disasters over the next 30 years. So you can see this is what is expected. If we click across the state, 91st, 96th, 94th, these things are just really high. So I've used Davenport a few times and I've looked at those areas with the asthma rate. So let's zoom back in there and see what that says. This is the highest asthma rate, 90th percentile. This corridor with the worst air pollution, 95th percentile. Some of these may be related to flooding. There's 14 natural disasters that they do. Base this on flooding, heat waves, hurricanes less relevant, those sorts of things. So my point being, those tabletop exercises will help us see where the risk is at. Even across Davenport, it's different. And even across Muscatine, it's different. But looking through and making sure that the people in decision-making authority have that available data too.
Cody, when you said 95th percentile, is that nationally or within Iowa?
It's nationally.
Nationally, okay. Great.
Mm-hmm.
And then one other thing that caught my ear, you mentioned that this is the best available data. How much of this data is still available and how much has disappeared?
Yeah, that's a great question. So I meant to mention this at the top. This map combines two sources of federal data that were already aggregators. So the Climate and Economic Justice Screening Tool was developed in 2021, I believe, by the Council on Environmental Quality through the White House as part of President Biden's Justice 40 initiative. So it took a lot of data and it put it all together at the census tract scale. So that's a lot of what you've seen. And then there was the EJ screen map, which is a lot of similar data, but more detailed and more granular at the census block group level. Our map took that and combined them both because there is value in both of them. And one of the things that we did is if you were to look at the prior federal site, you would see a map that's like light blue count or census tracts and white ones. If you clicked a light blue one, it was disadvantaged and it had like a list of why. We took the list and took the individual indicators and made them each their own layer. So we could look at flood risk, look at air pollution in our state and figure out, okay, what are the worst ones and where? And to Lena's point, neither of those two tools are available on federal web pages anymore. They were both updated late last year. And thankfully, we had pulled down the data in November of last year for this project. And so there are some publicly available backups that are from the Open Environmental, I think it's Open Data Network, Public Environmental Network or something like that project. And they have that up there, but I can find that link too and send it. It's actually in the user guide if you download it. Mary?
Yeah, just thinking about a really maybe good application of this is we have an extreme temperature plan.
Mm-hmm.
And so often we stand up cooling and warming shelters.
Right.
And I'm wondering, the energy one would be helpful in those cases, but is there any other maps that would be helpful in us knowing perhaps where to locate these shelters or plan for them or anything like that?
I would say there are two things on the map that can be helpful for you, and I'll show you them real quick. And one of them, I don't love this indicator, but it can be useful for this purpose. So it's kind of weird if you look at this one here. It's the share of the tract's land area, which are just these little census tracts, that's covered by impervious surface, and then they add cropland in, which is kind of weird, but it's really just to show that it's not usable green space is what they're trying to get at. So obviously all the cropland is going to be really detailed, but if you're up in Dubuque and you're looking through, okay, I want to see, these are the two neighborhoods actually in Dubuque that have the least amount of green space. It's covered in pavement. That happens to be the same census tract with the highest energy burden in the state. It happens to be one of the oldest housing stocks, happens to be one of the most diverse, I know, as well. And so these things start to add up. And so you can use this as a public health professional to say, like, what do we have here in this area as far as a cooling center, or as far as if there's a fire or something like that, how do we work with these people? The other thing that I would show you in terms of extreme heat is I'm going to turn that one off. And the other one I have on is the heart disease one. There are some of these medical things we put in here: heart disease, asthma, diabetes, low life expectancy. This one's the same. This is one of the higher heart disease, 92nd percentile nationally. That's one of the highest I've seen in the state. And then not the same one over here, 72nd, but just behind it, 89th percentile. And this one was the impervious surface one as well, 79th. So you can kind of see those patterns start to emerge. And that might be a helpful thing. And let's say I want to look at this one. I want to see what's underneath it. The mall's over here. Maybe we have some emergency and there's a power outage and people need a place to come charge their phones, right? And okay, I don't know how big that parking lot is, but now I can take a second, turn off those other layers, and I can just use it while I'm here as a planner and say, we need I don't know, this corner blocked off. That's an acre. That's enough to fit a couple trucks, tanks, whatever we want to do, if there's a water emergency or something like that. You probably have better tools for some of that, but it does help us kind of think about how we can use these maps to inform our heat response strategies for sure.
I'm going to jump in and just say thank you, Cody. This has really been fascinating. Mary Rose, thanks for the great questions. I'm sure you've kind of spurred some more thinking on others as well. Cody, if it's all right, if you could put your email in the chat, people could follow up with you if they have questions. And I just want to thank everybody for joining us today, joining us every month. We're happy to put on these Lunch and Learns as a way for us to gather and learn and share time together. Again, this is a benefit of that IPHA provides to everyone. It's from our education committee. If you are a member of IPHA, please reach out if you'd like to help with this, to join our education committee and help curate these sessions for us. If you're not yet a member of IPHA, you can do so very easily at iopha.org/join. We'd love to welcome you to our growing membership base here. Iowa Public Health Association is your independent voice for public health in Iowa, and we are committed to being so for as long as we can. So join us here next month on the third Thursday. That would be May 15th, where Carrie McCann from the Iowa Council of Foundations, and Cody mentioned the community foundations quite a bit. So Carrie McCann is my counterpart at the Iowa Council of Foundations, and she'll be here to talk even more about how public health departments, public health agencies, and teams, people doing great work in the field, can partner with the community foundations to have an even bigger impact. So thank you all very much. And like every one of our Lunch and Learns, this recording will be available on our YouTube site within the next few days to week. So thank you all very much.
Thanks, everyone.